and my brothers and sisters across Kenya and abroad. Good evening. I'm your host, Phoebe Ndeda, going to take you through Vertigo tonight. So, as you can see on your screen, vertigo is a condition. And when you're experiencing vertigo, there's a sensation that you or your environment is moving or spinning. And this vertigo, we have two types of vertigo. Remember, there are so many, but the most common ones are two. One of them being subjective vertigo, where you feel as if you yourself, you're moving. Then the other one is called objective vertigo, where you feel as if your entire surrounding are moving and every other thing is moving so fast. So that is how we can describe this condition, a sensation that you or your environment is moving. And you can see there are those two types. There are many, but those are the most common types. So as we move on, the first ones are forms of vertigo. Those two are forms of vertigo. So one, you feel as if you yourself is spinning, that is your the subjective one. But the other one where you feel as if your environment and all things are moving, that one is called objective. So we are going to look next at the types of vertigo. And as you can see on your screen, there are so many types, but we have two major ones. One being peripheral vertigo caused by inner ear or vestibular nerve issues. And the other one is called the central vertigo, and this one is caused by problems with your brain or your cerebellar issues. So when we look at this type, the peripheral vertigo, we are going to see different types of peripheral vertigo. And as you're seeing on your screen, as you can see there, it is the far more common type of vertigo, and it is primarily related to the inner ear. So the following conditions are classified as peripheral vertigo, as you can see on your screen. So the first one that I'm going to explain is called the BPPV, or you say the benign paroxysmal positional vertigo. Positional, why? Because it is triggered by specific head movements, causing brief episodes of spinning. So this one is the most common one. Many people experience this by just brief swing of head, like the way I'm doing. If I just swing like this, you feel vertigo. Sometimes you're just hanging your clothes, you feel that sensation of spinning, and either your environment is also spinning very fast. Sometimes you're just sleeping and you want to turn to the other side. You're tired of this side, you want to turn to maybe your right or left. That act of just standing, you feel as if the bed is spinning or you yourself is spinning hapo kwa kitanda, or your whole room is spinning. So that is what is called the BPPV. Now, what happens here is that we have certain things called calcium crystals. Now, these calcium crystals are also called autochenia. These autochenia are also called ear stones. You can also say they are called otoliths or ear rocks. So whichever word you can use there so that you can remember, you're free to use any of those ones. But I love calcium crystals because it is easier to remember. Now, these crystals are located in the cuticle and saccule part of your ear, as we are going to see as we move on. Now, and these crystals are located in your cuticle and saccule of the inner ear, and they play a crucial role in maintaining balance. So it means that these calcium crystals in the inner ear move and send incorrect signals to the brain, leading to a sensation of vertigo. And every time you have this vertigo attack, you must always find yourself having some dizziness too. Then the second one that I'm going to talk about is Meniere's disease, or you can say Meniere's, but I think the correct pronunciation there is Meniere's disease. So this one is an inner ear disorder that causes recurrent vertigo. So you keep on having vertigo recurrently, and it can make you have also hearing loss. You can also have tinnitus during this attack. And that one is another form. We also have one which is called vestibular neuritis. So this one is an inflammation of the vestibular nerve. That vestibular nerve is a nerve that carries balance information from your inner ear to your brain, leading to a sensation of vertigo. Then another type of this, we also have one called labyrinthitis. It is also similar to this vestibular neuritis, but it also affects the inner ear's function, potentially causing hearing loss. Another type is migraine-associated vertigo. So we have some individuals experiencing vertigo episodes during or between migraine attacks, and often referred to as vestibular migraine. So if you have sub-migraine and you have a vertigo attack, we say you have vestibular migraine attack. Then we also have another type that is called an acoustic neuroma. As you can see, acoustic neuromas are non-cancerous tumors, and they develop on the main nerve leading to the inner ear of the brain. So those ones are classified under what we call peripheral vertigo. Then under central vertigo, as you can see on your screen, we are going to talk about a few. Now, your brain or your cerebellar problems can cause vertigo. So conditions like stroke, you've seen people with stroke, people with tumors or infections in these brain regions. Particularly, we are talking about your brain stem, that long thing you're seeing there, and also your cerebellum. I hope you understand. Now, if you have infections in these regions, you can have a vertigo attack and also balance problems. The second type that can cause a central vertigo is multiple sclerosis. So the other time we were here and our doctor was taking us on multiple sclerosis. And those who are in class, I know you are well informed about multiple sclerosis. You know it is an autoimmune disease and can affect areas of the brain and also your spinal cord, responsible for balance, leading to this condition called vertigo. Then we also have migraine-associated vertigo with this. In central vertigo, we also have migraine-associated vertigo. So in some cases, migraines can trigger central vertigo due to changes in brain functions. Then the last one of this one that I'm going to talk about is the psychogenic vertigo. Now in this type, the dizziness or spinning that you're having is caused by psychological factors. So as we move on, we are going to learn so many things concerning this. And that is a summary of what happens in a BPV. You can see we've classified them, we've put them into smaller things for you to remember. So in BPPV, the main thing that happened there is the main thing is that it is short-lived. So it doesn't prolong. Some maybe seconds or some minutes. That spinning sensation that is triggered by specific head movements. Then it is also positional. So when you change position, when you tilt your head, unataka kubeba maji kuweka kwa kichwa. So it happens. Then you start feeling that feeling sensation as if you or your world is spinning. Now in Meniere's disease, you will have tinnitus. Remember, tinnitus is that ringing in your ears. In Meniere's disease, you will have hearing loss, and that is very dangerous. In this Meniere's disease, you have attacks in clusters. So what do we mean when we say you have attacks in clusters? So it means that when you're having a vertigo, a Meniere's vertigo attack, you can have a spinning sensation, and that spinning sensation is accompanied by maybe a headache, is accompanied by maybe feeling so full in your ears, things like that. So that is what we mean by attacks in clusters. So inakuja spinning plus a headache plus something, and maybe plus a nausea or vomiting also. That is what we say we call attacks in clusters. Then this Meniere's disease, as you can see there, we are saying long symptom-free interval. So it means for a span of time, you can feel as if you don't have any symptoms, but then after sometimes it comes. So inakuja kuja hivyo pole pole. That is what it means. So in vestibular neuritis, in vestibular neuritis, these features, we have these features. You have severe vertigo for days, haiishi. Vertigo leo, vertigo kesho, haiishi. So that is what it means. It is mild, persistent, and it is also positional. It is also accompanied by positional vertigo. So we are saying it has no auditory symptoms, meaning when you have this vestibular neuritis, you will not have an attack or a situation where you're not hearing anything. So it does not interfere with your hearing. Then that one, an acoustic neuroma, is accompanied by peripheral causes that can become central also. You have that vertigo, you also have hearing loss and tinnitus. Then labyrinthitis has those features. It has hearing loss, it has tinnitus, and also signs of toxicity. Now, what about central vertigo? These ones are kind of self-explained, as we had already seen. I'm just going to move on to the next one. I hope this one is self-explanatory. We had already talked about these ones. So on your screen, you're seeing an anatomy of the ear. So I put that anatomy to help us understand certain important things about the ear. So I want you to study that diagram vizuri. Imechorwa vizuri sana, that diagram. You can see the pinna, you can see external auditory canal, you can see the lobule. Pinna ndio penye watu tunachunwa tukiwa shule. When you're not hearing things well, the teacher teaches and you're playing, they pinch there very well and you feel as if it is very hot. Hapo ndio pinna iko. So as you study that diagram, let your eyes cut across and see across. And we are going to see the importance of these things as we move on. I hope it's going to help. So this pinna, its other name is called the auricle. So its function is to gather and funnel sound waves into the ear canal, acting like a reverse megaphone. So it also selectively filters sound to help your brain pinpoint where noise are coming from. So you've always seen people who are saying maybe like today, a Thursday, on this side of the world, you hear a lot of noises. You hear because there are a lot of funerals here. So you can hear maybe sound here, and if your pinna is not working well, you think maybe the sound is coming from the other side of the pinna. So look at it very well. So as we are talking, I want you to study that diagram because we are learning. And the next organ is the external auditory canal, as you're seeing there. So that one, its work is to funnel. It funnels and directs sound waves to the ear drum. And additionally, it also acts as a resonator to amplify speech frequencies and also protect the delicate middle ear from foreign particles, insects, and bacteria using fine hairs and also earwax. So, masikio inakuanga hapo na tunywele and also that earwax. So that is its function. Now, as we move on, you can see the eardrum there. Now, that eardrum separates your out and middle ear. And its function is that it acts as a receiver or it acts as a receiver for sound waves by vibrating when struck by acoustic energy. So acoustic energy ndio inaleta sound hapo hivyo kwa eardrum. So the vibrations are transferred to the middle ear bones. So those middle ear bones are called the ossicles. So if you hear ossicles, it means those three tiny bones down there, they have been extracted from up there alafu zimeletwa hapo chini. So those ossicles, the sound is transmitted there to be processed into hearing. And you're going to hear vizuri, you're going to understand. Now, those three bones, as you can see, we have the malleus, we also have the incus, and also the stapes, or the staples. So these three tiny bones, they work together as a biological lever system. So their purpose is to transmit sound vibration from the eardrum to the fluid field inner ear while amplifying the sound's pressure so that it can be properly processed by the brain. So your step is after to confirm. You see those three tiny bones, they work in unison. Zinawaka kama liver. So after they have all confirmed that what they've heard from the eardrum is okay, now step is becoming a staple. It is confirming that this is what we've heard. And now it transfers that to your cochlear for processing. Okay, then the next one there, we are seeing the eustachian tube. Now, this eustachian tube connects the middle ear to the back of the throat, and its function is one, that it equalizes air pressure in the middle ear, so the eardrum can also vibrate normally. Two, it drains mucus and fluid away from the middle ear. And the third one, it protects against loud sound and pathogens. So when the tube is blocked or fails to open, often due to maybe allergies, sometimes you have a cold, sometimes you have a sinus infection, you can develop eustachian tube dysfunctions, leading to symptoms like a feeling of ear fullness, muffled hearing, or even ear pain. Then we have now the cochlear. Now that cochlear is that thing that looks like the back of a snail, as you can see up there, across there. So it is filled with a fluid and is spiral-shaped cavity in the inner ear that transforms mechanical sounds vibrations into electrical nerve impulses. So this allows your brain to perceive and interpret different frequencies and volumes of sound. Then you can also see the vestibiocochlear nerve, or there's a baptism for that nerve, the vestibulocochlear nerve. It is also baptized the cranial nerve, or cranial nerve the eighth. That is a sensory nerve that transmits sound and balance information from the inner ear to the brain. And it consists of the cochlear nerve, which is for hearing, and the vestibular nerve, which is for balance. Now, the cochlear nerve transmits auditory signals from the cochlear to the brain. The vestibular nerve transmits information about head positions, movements, and also spatial orientation. Then we have those semicircular canals. Their work is to maintain balance and spatial orientation by detecting rotational or angular movements of your head. So as you study that diagram, I hope you're now going to understand our next diagram. Has refused to move. Okay, what I'm coming at is that next diagram. So I hope it is saying how hearing works. So what happens when you're hearing, you're going to understand. So it means that when your cochlear, as we have seen, is an organ within your inner ear that helps you hear. So it is filled with fluid that moves in response to sound waves, and it's split into three tubes by two thin membranes. We have that basilar membrane and the tectoral membrane. And the basilar membrane is like an elastic wall on top of which sits that organ of Corti, as you see there. Now, that organ of Corti contains tiny hair cells with stereostylies at the end. So these stereostylies are delicate hair-like projections that react to cochlear fluid movement. Thus, they're the ones that send now signals to your brain for translation, and it causes you now to act on whatever you've heard. And that is how your hearing works. So in our other diagram, that is just to show you parts of the cerebellum where if you have any infection or tumors, you're likely to experience this vertigo attack. So as you can see, I hope that one is stuck on your mind. Then, at least now we are going to look at the causes of vertigo. So, from the time we started talking about this vertigo, we have seen many other causes of vertigo, one of them being inner ear disorders like the BPV and the Meniere's disease, those kind of labyrinthitis, the ones we were looking at earlier. We also have brain conditions like stroke tumors, as we had already seen, lack of sleep, and dehydration. So what are we saying? Lack of sleep can disrupt these processes, potentially leading to vestibular system dysfunction and an increased risk of vertigo. Then we also have head traumas and infection. So you can get a head trauma maybe during an accident. Anything can happen and you can get a head trauma. Sana accidents. Kitu imehit kichwa hapo, or you fell from a tree. Anything can happen and that one can lead to head trauma. And if not treated, it can also be infectious. Then we also have things like allergies and sinus congestion. So those ones, allergies and sinus congestion. So having an allergy can trigger vertigo. Why? Because when you're having an allergy, maybe from dust, you feel as if you want to scratch your throat, or you want to scratch your ears, and you don't know how. That it happens mule ndani, and many of us do certain things that are not okay. Some people use their hands and they do it so vigorously, and that one is not recommended. Some people just push in things there to scratch your inner ear. So those allergies and sinus congestion can cause a lot of trouble and can also cause us to have vertigo. Now, when you think about dehydration, we are saying that people who are dehydrated often have reduced blood pressure or lower blood volume. So when this happens, blood may not reach your brain in the way that it should, and this can lead to vertigo. Bacterial infections like those ones we were talking about, kina allergies, kina sinus congestion, and we also have blood viscosity, a very dangerous one. So one of the main causes of vertigo is blood viscosity. I want you to understand that and to know that, and how, because people who are hyperviscous, or this thing we call hyperviscosity, slows down or obstructs circulation in the tiny blood vessels that feed the inner ear, or disrupting the vestibular functions, causing spinning sensation, and for the do we say vertigo. Now, that viscosity, this viscosity thing is dangerous because it also brings what we call inner ear hypoxia. So hypoxia generally means lack of oxygen. So the inner ear's balance organs are highly sensitive to oxygen levels, and we know that sluggish or restricted blood flow can also cause tissue hypoxia, leading to vertigo and sudden hearing loss and even tinnitus. We also have another condition that is brought by this blood viscosity, and we are saying that viscosity can also bring about what we call the venous obstruction. And we are saying this happens when thickened blood obstruct the small draining veins of your inner ear, increasing inner ear's fluid pressure. So when that happens, definitely you're going to have a vertigo attack. Viscosity also brings about systemic disease. And what is it? It means that this blood hyperviscosity is often a symptom of underlying health condition like we say, or we call it polycythemia vera, meaning too many red blood cells, or the Waldenstrom's macroglobulinemia. That is also a type of blood disorder or a blood protein disorder. So that is the danger of having viscosity. Then another ones, we have allergies, as we had seen. The throat can cause inflammation in the eustachian tube, disrupting their function and potentially leading also to vertigo. We also have complications from drinking alcohol, and we are saying alcohol significantly impacts the brain both in short and also in long term. So these short-term effects include impaired cognitive function. We also have slurred speech. We have blurred vision, and also decreased coordination. That is why alcohol is not good. And its long-term effect means that you're going to have a total cognitive decline, memory loss, and also permanent brain damage. We have talked about sinus. Now, what happens when you have a sinus? It affects your eustachian tube and also that ear pressure thing. So that intense or forceful blowing can disrupt this pressure balance, leading to vertigo. And that is what happens. Now, we also have infections, including those that cause tonsillitis, can also lead to inflammation of that vestibular nerve, causing labyrinthitis. Coughing can trigger vertigo in certain individuals, especially those with conditions like superior canal dehiscence can also have this, especially when they are coughing. We are also saying that when you have a swollen thyroid, like a goiter or thyroid dysfunctions can potentially trigger vertigo by putting pressure on nearby structures, including those involved in balance. So thyroid disorders like the Hashimoto's, as you know, Hashimoto's thyroiditis have been linked to vertigo and balance problems. So if experiencing vertigo having this, please seek the intervention of an endocrinologist. We are also saying that excess toxin buildup in the brain, including the cerebellum, can contribute to vertigo, and hence the importance of detox. Now, pregnancy can also trigger vertigo. Know that. Why? Because of hormonal changes, increased blood volume, low blood pressure, blood sugar fluctuations, pressure on blood vessels. You can also have anemia while pregnant, and those ones can trigger vertigo. They're also saying some people also experience menstruation can cause vertigo. So if you're having a vertigo attack and you're pregnant, please seek the intervention of an obstetrician who is going to help you through your pregnancy so that you don't have that vertigo isikutesesana during that period you're carrying that tiny little thing. Now, during menstruation, we have a lot of hormonal fluctuations. We have anemia from heavy bleeding. We also have dehydration. And we also have that impact of prostaglandins on blood vessels. So what are these prostaglandins? So they are substances responsible for menstrual cramps. So those are what we call the prostaglandins. And they can constrict blood vessels when produced in excess, leading to vertigo, as you can see. Now, the diagram you're seeing there is to help you understand. Imeziweka kwa cluster so that to help you learn for learning purposes. So let me see our next slide is talking about symptoms of vertigo. Now, when you have a vertigo attack, definitely you're going to have dizziness. That is one of the things you're going to have. Then you will also have nausea, vomiting. Those are certain things that can happen when you have a vertigo attack. Now, anytime you're having a vertigo attack, remember, you can be sweating. You can have pallor and also imbalance. Another thing that will happen, a symptom when you have a vertigo attack is tinnitus and ear fullness. In many times, you will have a headache, you will have nystagmus. So nystagmus means an involuntary eye movement, eyes roll. So that is what we call nystagmus, roll uncontrollably. So as you can see on that diagram, it is going to help you understand, and it is put in clusters. So we are seeing dizziness there. We are also seeing ringing in your ears, trouble swallowing. Those are symptoms of vertigo. You have trouble swallowing. No, vertigo inakuja. Nausea or vomiting, limb weakness, and especially weakness on one side or both limbs. And especially if you just hear that one side of your limbs are not functioning or they're weak, that one sasa usicheze na hiyo. Then loss of balance, meaning you're not going to balance, you're going to fall. And if you don't have something in unaweza jishikilia, probably utaanguka. Sweating, slurred speech, and also vision problems. Then moving on to our next slide, we want to see how we can manage this vertigo thing. Remember, we have talked about how it happens, and it is one of the things, it is one of these conditions where you can easily detect or say, I had a vertigo attack when I was doing this, I had a vertigo attack maybe when I was pregnant or when I was going for menstruation. It is very easy to know when you had a vertigo attack, and that is going to help you even know what to do about your vertigo attack. So on management and prevention, we are saying that you sleep with your head elevated by 45 degrees. So your pillow should be at least 45 degrees. The next thing that you can do is do an e-play maneuver to reposition those inner ear crystals. So an e-play maneuver is just a therapeutic series of these exercises and body movements used to treat the BPPV. So kuna venye ukiwa na vertigo and you're doing an e-play maneuver, it means you keep on tilting your head to a position where you don't feel it again. Another thing, when you're having this attack, you sit down. Pole pole, just sit down. And when you're rising up, rise slowly. And another thing, when you're having this vertigo attack, it is important that if you have an attack ukiwa pale nje kwa sun, remember, hata exposure kwa ile cruel sunshine, ile after the 9 or after the 10 signs, tuseme tu sunshine from around 12, 1, 2, 3. Hiyo jua ni kali sana. So if you expose yourself to that hot sun, remember you can also have vertigo. So anytime you're having this or you have a vertigo attack, you can always close your eyes so that your eyes does not give you some information. Just close your eyes and then sit down. You can just lie down. And then when you'll be rising up, you rise up slowly. So if you have trouble balancing, you can use some walking aid for stability. Also, avoid loud noises. You see, these people who like putting earphones kwa masikio alafu wanaweka volume juu sana. That volume and that hiyo tabia yenye umezoea kuweka hizo earphones hapo is going to cause you one of these days very bad ear issues. So make sure even when you're using those earphones, volume isiwe juu. Utameweka volume hata ukimwita hizi sikia. So avoid those ones. Na hata ukiwa kwa nyumba, please, when you're in your house, do not put a volume that you are hearing plus your neighbors. In a house or in a room, those people in that room are the only people who are supposed to hear that sound. Anybody else that party from outside is not supposed to hear the noise that is coming from your room or your apartment. Be private. Your noise lazima ikuwe tu within your premise yako. So also clean your ears gently. Don't roughen up cleaning your ears. You can also use the over-the-counter ear drops or get professional ear cleaning. Now, I'm also adding that you need to manage your coughs, you need to manage your cold in time. You also need to manage your sinus congestion. Treat and manage your thyroids also and other infections. You can also manage your hormonal issues by using the right products for hormonal balancing. You can also use a soft, clean, damp cloth to clean the outer ear and to remove those debris and the dirt. Avoid cotton swabs. And why should you avoid cotton swabs? Because most of the times when you go to the supermarket and buy those cotton swabs, most of them overstay in those shelves. So when you go use them, maybe without some oil, zinabakisha, they put some, zinabakisha hizo particles za hizo cotton sparings huko kwa masikio. Then sometimes you'd think as if you're cleaning your ear, then when you're removing it, it has remained inside. Or instead of removing wax, it further pushes that earwax further inside. So even when you're using that, it is not recommended that you use cotton swabs. You're supposed to avoid them. And if you're to use that, cotton swabs, then dip in some oil, like the baby oil, the Johnson's baby oils, or the over-the-counter oils that you're going to be given. But you must also contact your doctor for which one to use the best. Now, don't force anything into your ear canal, and especially when children are looking, because watoto wengi or most children, they always copy what we do. So one day you're not going to be around, they're going to be in school, they're going to pick up something, they're going to put them in their ears, then they're going to start having kinautoria and other ear infections. Even adults, I've seen adults sometimes if you go for parties or we go for some funeral things, you see them just pick. Nasikia mtu anasikia kuna masikia anatafuta kijiti kwa wapi. Kijiti kwa wapi saa zingine somebody maybe you're picking that kijiti, you're already putting it in your ear. That one is not recommended because you're putting germs inside and you're going to cause some infections because of those germs. So use a clean thing to clean your ears and clean your ears the right way. I'm also saying that you need to detoxify your system often. At least after every 3 months, just do some detox. Detox is very important because most of the time tunakuanga na brain fog, unasikia tu mwili iko poa. And that detox helps the brain. So when your brain is so foggy, it is important that you detoxify. And let me tell you, when you want to remove toxins fast from your brain, just use the chitosan capsule. Another product that is so good in removing those toxins from your brain is blueberry coffee. It is really going to help you. You can just try it. If you have that fogginess and you have a lot of kichwa kuja, just use that blueberry coffee. I'm also saying that when managing vertigo and you have some cold or some flu, make sure that when you're blowing your nose, blow one nose at a time. Don't blow like this. Here's my hand. Don't blow like this, yeah? Blow one nose at a time. And make sure you blow again, till uksikie kama hiyo pua imekuwa relieved. Is when now you can go to the next ear. Because if you do like this, it is going to insert pressure in your eustachian tube, and that is going to trigger vertigo. So do it correctly. So when having an itchy ear, be gentle. Don't be so rough. Some people wanaingiza kidole, then wanafanya haraka. That one can interfere with those 3 tiny bones, kina malleus, stapes, and incus. So do it gently. Do not roughen it up. We can do certain things we call ear irrigation with either a syringe or a professional help might be necessary. So a syringe or a specialized tool can be used to flush out ear canal with water, either alone or after softening that earwax with some ear drops. You can do that. Another thing that interests me in this vertigo, and I'm saying monitor your children well when they come from school. And why am I saying this? Because I'm considering these children born with this condition called dyslexia. So as you know, many of us are busy parents, and many of us, we are not keen to see or to confirm watoto wetu wametokaje shule. Even our children, they undergo stress, they undergo bullying, they undergo a lot of things. So you must always find out from them. How was school? You bring them close to you because you want to understand. Now, if you have a child with some condition, sana that is making them learn so slowly, what you must do is you must become a friend to those teachers. If those teachers don't know, especially as women, kutuna midomo tu ndo tumekanga tu mbele ya kugombanisha watu, kugombanisha walimu. Believe you me, if you have a child with dyslexia, so let me just explain what dyslexia is. Now, we can say that it is a neurological learning disability that affects how the brain processes written and even spoken language. So it is a lifelong condition that causes difficulties with accuracy and fluent word recognition, reading, writing, and even spelling. And it is also said, because these kind of children, if you take them for diagnosis, their doctors will tell you that despite these challenges, these individuals with dyslexia, they possess average or above average intelligence and can thrive with the proper education support. So if your child is suffering from this and you're not supportive, you're not a friend to your teacher, believe you me, hata hao watoto huwa wana undergo vertigo. And because they are slow learners, they are prone. Slap it a bit too, because they don't catch things vizuri. They don't catch up things very fast like other normal students. So their teachers will keep on slapping them. Watakuwa na chunwa masikio from the pin, and that one even worsens that condition. So you must always be very keen and be supportive with your teachers. So anything that can help aid the education of that child, please do. And believe you me, that their conditions worsen because they don't, those kind of children don't like noise. They don't like to be shouted at. In fact, the more you shout at them, the more sasa unawa confuse kabisa. Wanakaa tu kama zombie. Wanakuwa tu kama zombie. So monitor them very keenly with your teachers and always just try to find out. Sometimes it is good to also bring up your story because none of us was very innocent when we were learning. Most of us were very cheeky. So bring yours there. If you bring yours there and then they also see, hey man, kumbe you are also like this. Now they start opening up and then they'll tell you. So you will know a lot of things that happen in school and you can always guide your children, believe you. So that one said and done. I want us to look at certain myths about or surrounding vertigo. So we have certain myths surrounding vertigo. So some people say that vertigo is simply dizziness, which is not true. Some people also say that dizziness is fear of heights, which is also not true. And some people say that it only affects the elderly. It is not true because it also affects small children, especially with that condition of dyslexia. We are also saying, some people also say that this vertigo is a disease with no effective treatment. That is not true because in reality, vertigo is a symptom with diverse causes and is often treated. You only need to know at what time did it happen, what really triggered it. So it is very easy to monitor a vertigo attack and you can easily treat it at home. So before we endelea, what is the difference? Because vertigo, you hear vertigo and then you hear dizziness. Somehow they are so close, and we are saying that while both they involve feelings of imbalance and also disorientation, vertigo is characterized by a sensation of spinning or movement when someone or a person is stationary. Imagine umekaa and you feel as if the entire room is moving or your environment is really spinning. And dizziness is a more general feeling of being lightheaded or unsteady. We can also say that dizziness is a broad term for feeling off balance. You feel lightheaded or you feel woozy. And vertigo is a specific type of dizziness that creates a false sensation that you or your environment, you're spinning. So I want you also to note that all vertigo is dizziness, but not all dizziness can be vertigo. It is important to know that anytime you have a vertigo attack, it will be accompanied by dizziness. But not anytime you are dizzy means that you have vertigo. That is very important to note. So let us look at some of the natural remedies and lifestyle. Number one, we need to stay hydrated because hydration helps us not to incur vertigo. I hope you know that. Get enough sleep. Manage allergies and sinus congestion. Eat healthy and avoid alcohol. You can also add there exercises. But you see, there are exercises like aerobics. We have exercises like aerobics. Unafanya, those ones can really bring a lot of it. So if you do aerobics and you feel vertigo, please look for other exercises. We not only have the aerobic thing, we have so many that you can do. Not simply just aerobics. Then we want to look at some of our products that can help you manage vertigo. So as you can see, we have so many products, Greenwald products that can help you manage this condition. But even so, please make sure that when you're having these and things are not going so well, make sure you see an ENT specialist. Make sure you also see an otolaryngologist, and you can see an obstetrician, especially with issues of pregnancies. Issues with thyroid, you can see an endocrinologist, and issues with the ear and nose and throat, an otolaryngologist. Then we also have these Greenwald products that will help you so much manage your vertigo. We have ginkgo biloba. As you know, ginkgo biloba improves circulation. So if your blood vessels are circulating well, you don't have a problem, you don't have elasticity, you don't have these issues with blood vessels being so tiny, ginkgo biloba will help support that, hence reduce the impact on vertigo. Cordyceps is very important because it reduces inflammation, and remember, just by taking vertigo, it improves the health of your lungs, in that now your lungs are in a capacity or capability to absorb enough oxygen through the air circles. Then we also have chitosan, very good for detox and also vascular support. We have Kuding tea, which can help relieve sinus congestion, and others. You can also add their Jinpu tea and even the capsule itself, very good. You also have Ganoderma. You can use that one for immune support. You can use blueberry juice. You can use propolis as an anti-inflammatory, and also you can use vitamin C. Now, lastly, with this vertigo, when to seek help? When do you need to seek help? If you have a vertigo attack with fever, please seek help. If you have a vertigo attack with vision loss, please seek help. If you have a vertigo attack that is causing you to have hearing loss, you need to seek help. Trouble walking, a new headache that is very different from the ones you have, seek help. Weakness or numbness, please seek help. Inability to perform daily. Let me tell you, this vertigo can make you not do anything. Ukienda kufanya anything, it comes just spinning the whole day. And if you see it persists like it, you cannot now do most of the things, you need to seek help. Sudden severe headaches, seek help. Sudden loss of hearing, seek help. Chest pain, seek help. Difficulty speaking, seek help. Weakness on one side of your body, please seek help. Okay. Now, some people say that, especially now, this thing, when you're in an elevator, manake umepanda lift. Now, what always happens when you are in a lift and you have vertigo? Ukiwa kwa lift, na usikie hiyo spinning sensation, what normally happens is that your brain receives conflicting signals. Your inner ear detects vertical movements and gravity, but your eyes are locked on the stable elevator walls, and they perceive some stillness. So you have that confusion that is called visual vestibular mismatch, and that is what happens. That is what happens when you are in an elevator or saa zenye unapanda lift. So that thing that happens, si ati unaogopa heights. It is not that ati you're scared of heights. That thing is something that is triggered by your movement here and down, and now it causes some vestibular mismatch. Some people also say that they have it sana when they are driving. It is the same thing because your eyes perceive rapid motion, but your inner ears don't sense the same movement. So this mismatch confuses the brain. Now, other common triggers will also include visual scanning. Yeah, unaona venye gari inapita unaangalia vitu tu zinapita. So that one also confuses those things. Then neck stiffness, umekaa in one position ukiangalia mbele. So wakati maybe gari itasimama, then you're told, oh, now you can go, maybe ease yourself, then you feel that kind of spinning. Those ones are triggered because una sit for a long time with a stiff neck and that prolonged posture for a very long time. So Mr. Fred, that is the little I can share today, and I hope imesaidia mtu hapo. And in summary, we can say that vertigo is a symptom with many causes, as you have seen. It is a symptom with many causes. Just know the type and also the symptoms. And we are also saying that early diagnosis and management can improve quality of life. And I can just say thank you very much for your audience. And